Greetings to everyone. My name is Sheik Hussain. I have completed my PharmD post-baccalaureate. My qualification is PharmD PB, and I have completed B.Pharmacy in St. Mary's College of Pharmacy, Andhra Pradesh, and PharmD PB from Vikas Institute of Pharmaceutical Science and Research, Rajahmundry. So today I want to teach a huge. Before going to teach, I should tell some points regarding few points. The point number one, my experience. My experience first, previously I have worked in Vikas Institute of Pharmacy as a associate professor. Later on, I went to competitive field and I have taught for Prometric centers. Prometric center is nothing but Dubai Health Authority exam, Saudi Arabia exam, and other countries entrance exam, so that I help the students to clear all that exams. For that one, I choose some academies like Medline Academy in Hyderabad and Bioplanet Bangalore, and I have experience of 4 years only in pharmacotherapeutics and pharmacology for competitive field. And about my experience, I have cleared several other exams like Dubai Health Authority exam I have cleared, Qatar Prometric exam I have cleared, Hard exam I have cleared. All these exams I have cleared by my own, with my own notes. So my notes and my lecture specialty, what I think is that every layman, means from a topper to a below average student, should understand the lecture. That is my specialty of the class. So today I want to teach a simple topic regarding the pharmacology. Is nothing but about digestive system and the disease associated with the digestive system, and all I will teach under one board. Means the disease is not a simple disease. It will be complicated of some or one or two other diseases. So all the diseases I will come together in only one board, and I will try to explain with the drugs, the mechanism of action, and the disease pathophysiology and the treatment for that. Thank you. Okay, digestive system. So I will write a digestive system because as we are about little advanced stage, so I don't want to write this digestive system physiology and all. I want to direct go into the disease or disorder known as ulcer. Ulcer. So before going to ulcer and treatment of ulcer, I want to teach the anatomy of the stomach. Okay, inside the stomach, if you go into the microscope, they will produce one cells known as rugae. Okay, and these are known as rugae. These rugae are such a big that if a rugae was expanded, it will be 1200 square kilometers. Means the rugae is such a big thing that was complicated. It will make it into folds, and it is known as rugae. The rugae will be present inside the cells. Inside the rugae, there is known as a pit, otherwise known as a gastric pit. Gastric pit, where the HCl is produced. Okay, in this step, from this gastric pit, how the HCl is produced is the most important thing. First, this digestion. Here, it will be the blood vessels or blood vessel. From inside the blood vessel, there will be a transport system for carbon dioxide, otherwise known as CO2. Okay, this CO2 combines with the water molecule which is present inside the stomach. So H2O plus carbon dioxide gives hydrocarbonic acid, is otherwise known as H2CO3, hydrocarbonic acid. Okay, from here the hydrocarbonic acid H plus ions will be released through the stomach under one pump. So in order to produce H plus ions from here to here, for the pump require energy, and the energy is otherwise known as ATP. And for the production of ATP, and it should require ATPase enzyme. For every travel of hydrogen, it will always release potassium from from the stomach. So from blood cells, potassium will enter inside the stomach, and H plus ions will enter from here. So ultimately it produces H plus ions and production and introduction of potassium. So, and this pump is known as a hydrogen potassium ATPase pump. Simply for our understanding, now I will write a proton pump. So it is known as a proton pump. So proton pump will produce H plus ions. So where the Cl come from? From the bloodstream, Cl will comes directly. So H plus Cl together produce an acid known as HCl. HCl is such a strong acid that if, for example, take your hand and put inside the stomach, for example, just assume our hand even also will digest the same like the meat which you have consumed. So such a powerful acid is this HCl. HCl acid is such a powerful that no other acid to the human science have recognized such a powerful acid. So HCl is considered as such a powerful acid. So it is known as a hydrochloric acid, which will be very useful for digestion. So this is how the HCl is produced. So what is the relation for ulcer and HCl is that as the HCl production is more, as there is a damage of rugae, the system or the rugae, as the rugae is affected, the inside tissue will be directly exposed to the HCl. So HCl will come and act and directly acts and will produce some amount of pain. Sometimes it will be dangerous also. So this is known as an ulcer. So what is the primary treatment for ulcer is that one. We should reduce the production of HCl. We should reduce the production of HCl. So if we stop sodium, so if we stop this hydrogen potassium ATPase pump is nothing but proton pump. If we stop, we can reduce HCl production. Point number one. We can reduce proton pump. So this is point number one. Point number two, that there will be some cells known as histamines, okay, inside the parental cells. Through H2 there will be some histamines are of 4 types: H1, H2, H3 and H4. But for our better understanding right now, or relying upon only the ulcer, we will take only H2 receptors. What will do this H2 receptors? H2 receptors are the agents which produce hydrochloric acid. So H2 receptor agonist will produce HCl. So H2 receptor antagonist we will use. So H2 receptor antagonists we will use for less production of HCl. This is target number 2. Target number 3. So aim of the ulcer is that to reduce HCl. Okay, I am talking about that one. So point number 3 is that if the rugae has damage, there will be protectant, or that is known as ulcer protectants. So there will be a lining. There will be a lining. So it's here this rugae. So there will be lining for the protection of HCl not to encounter with the cells which is present after the rugae. So third point is that about not to encounter protectants, otherwise known as ulcer protectants. Okay, ulcer protectants. Fourth one is that very easy thing is that HCl is an acid. So in order to reduce this acid effect, we will use another thing known as a base. So anti-acids are nothing but the base molecules which acts against the acid and reduce the effect of acid. If it comes and touch also, we will not feel any other means any danger affecting. So base things like antacids we will use. We will use. Okay, antacids we will use. And fifth and foremost thing is that we should know about PG. What is meant by PG? PG is nothing but prostaglandins. prostaglandins. So prostaglandins are nothing but they are the pain mediators. Pain mediators. What it will do? The prostaglandins will reduce HCl production, and prostaglandins are the agents which increase the mucus production. This is the most important thing. So prostaglandins will reduce the HCl production and will increase the mucus. So if the mucus effect is increased, then ulcer protection is also increased. So mucus production if increased, ulcer protection is also increased. So prostaglandins are the agents which are the pain mediators. Now coming to our ulcer concept, they are the agents. We should remember two things, that which decrease the HCl effect and increase the mucus effect. So mucus and how, why? Because there will be some sort of reaction. This is unnecessary matter right now for the ulcer point of view. So which will reduce the HCl and should increase the mucus protection. So this mucus protection will protect from ulcer, and second thing is that it will reduce the HCl thing. And some believe that ulcer is also produced by bacteria. Okay, bacteria, gram-positive bacteria. Gram-positive bacteria is nothing but pyroli. Okay, pyroli. This pyroli is one of the bacteria. Okay, I am not talking much about that Clostridium pyroli, because every human being have the pyroli bacteria, even for you, even for me, everything. But that pyroli, okay, if attacking the gastric system, mucus system, and destroying the rugae and enter after the rugae or cells, when it reaches inside the stomach, that will be a problem. So every human being have a pyroli. Okay, so pyroli, to kill the gram-positive bacteria, we will use an antibiotics also. Antibiotics which can treat gram-positive bacteria, like amoxicillin, like there are several things like metronidazole. Okay, there are fluoroquinolines which can all treat this gram-positive bacteria. Okay, so we will talk about this thing later. Okay, so these are the aims where the acid and this thing can be reached. Now coming to my point is that the only thing we should remember in pharmacology is that whenever we are giving the drugs, we should remember 2 points. One is whether these drugs cause another side effects which may be major. So we should use combination therapy. So whenever you have gone to the pharmacy, generally whenever we have given NSAID, painkillers, we will give antacid or pantoprazole inhibitors or H2 receptor antagonists or proton pump inhibitors. Why H2 receptor antagonists or proton pump inhibitors? Why we are giving? Okay, we will talk about that one later. The combination is given. So my aim is that whenever we are giving the drug, we should treat that side effect with another drug. For example, pantoprazole, cost of pantoprazole in our market is 6 rupees, but NSAID cost is 2 rupees. So in order for the NSAID to work in body perfectly without causing any gastric damages, we are using 6 rupees tablet of pantoprazole. Why? We will understand in this concept. Point number 2. Whenever we are giving the drug, okay, the important thing we should learn is that whether this drug combined with, this drug is combined with another drugs, is it causing any damage or not? That is very important. For example, we are giving antacids. So when you are in pharmacy, so someone is coming and asking, so sir, please, we are feeling gastric disturbance or gas, or we are feeling little pain. So what you should give means you should give antacids. So in the pharmacy, you should ask that whenever you are giving antacid to the patient, you should ask him perfectly that whether the motion is free or not. So if the patient is constipation, means he is not feeling for motion perfectly in early morning. If he is constipation, and if you want to give antacid, then you should give one type of antacid. And if the patient is not constipation, he is having a laxative, means he is having loose motions, laxative effect, and if you want to give antacids, another type of antacids you should give. So these are not related to ulcer, but these are the points we should always remember when you are in pharmacy or when you are in pharmaceutical science, when you are learning pharmacology. So that much perfectly you should learn for the encounter of this one. Okay, so now when the patient is having a constipation, okay, we should not give, first what we should give is a magnesium hydrochloride. Magnesium hydrochloride. If the patient is having already laxative effect, another systematic circulations like sodium bicarbonate you can give. So if the patient is having a laxative effect, he is having motions. So in order to stop the motions, you can use sodium bicarbonate as to stop from the laxative and as well as to treat the antacid. So magnesium hydrochloride, if you give, the magnesium hydrochloride will produce the laxative effect and it can act as antacid also. So these are some points we should always remember. Now coming to H2 receptor antagonist. Example, the most important drug is that famotidine. This is a so potent drug. What is meant by potent drug? So always remember, my lecture is about to understand from a very poor student to top ranker. So the thing is that famotidine is a potent drug, which potent means the small drug which can show big action is known as a potent drug. For example, digoxin, which is given in hypertension. Okay, sorry, digoxin is not given in hypertension. Digoxin is used to treat, is a cardiotonic drug. So digoxin, usually the molecule is 0.625 μg. If we increase more than 0.625 μg, the cardiac arrest will come and the cardiac functioning will be stopped. So that is meaning of potent. So whenever we are giving a potent drug, you should be very, very, very careful that you should always have the prescription in your hand. Second thing, potent drugs, whenever we are giving, you should always remember that the dose calculation is so much necessary, because as the dose is increasing, it can cause a serious problem. So famotidine is a very potent drug which belongs to H2 receptor antagonist and which can stop HCl production. That is important drug. And there is another useless drug known as cimetidine. Of course, it is banned. Cimetidine. Okay. See, cimetidine is a drug where it produces anti-androgenic effect. Anti-androgenic effect means androgens, okay, will be decreased if we use the cimetidine. There will be other drugs which can increase which can produce anti-androgenic effect, that spironolactone, ketoconazole, okay, spironolactone, ketoconazole are also the class of drugs which can produce anti-androgenic effect. This anti-androgenic effect we will discuss it later, means in future we will discuss this anti-androgenic effect is none of the business right now. So I'm just telling about for your knowledge that cimetidine. So and cimetidine also have enzyme inhibitor. Enzyme inhibitor will be high if we use a cimetidine drug. So this anti-androgenic effect and inhibitor are coming to cimetidine drug. Cimetidine produce anti-androgenic effect and enzyme inhibitor. What is meant by enzyme inhibitor? For example, take one glass. Okay, take one glass. Pour some enzymes. Okay, so take enzymes from your stomach and pour some enzymes. Put one tablet into this one. So for a tablet okay, to become half of its concentration. For example, in systemic circulation, if it reaches 50 mg, and the time taken for a drug from 50 mg drops to 25 mg. 50 mg you have given a drug, after some time it will reach us to 25 mg. How much time have been taken for reaching 50 mg of a drug to 25 mg is known as T half. So T half definition is that the time taken for a drug to become 50% of its initial concentration, when it reaches into systemic circulation, or the unchanged drug without metabolism, when it time taken for a 50 mg to reach 25 mg is known as T half. Now, enzyme inhibitor. What is the relation between a T half and an enzyme inhibitor is that, for example, this is the enzymes. Okay, these are the enzymes which we have put. Now, along with this tablet, I have put this cimetidine also. So, for 50 mg of a drug to become 25 mg, for example, it take 30 minutes of time. It's an enzyme inhibitor. It is stopping the enzyme. So, what will be increasing is that T half is going to increase. Means the time is taking more to reach systemic circulation. So, whenever we are giving cimetidine, if we are taking another type of drugs, the time taken for a drug to become T half means 25%, means 50% of its initial concentration takes more time. The T half is going to increase. So, we should be very cautious that whenever we are giving cimetidine, if we are taking another drug, it takes more time to remove from the body simply, because the T half is increasing. That is the meaning of a T half. So, whenever you are using a cimetidine, it's an enzyme inhibitor. So, as it is an enzyme inhibitor, I am telling that T half, the time taken for a drug to become 50% of initial concentration will increase. Means it takes more time to come out of the body. So, this is all about the enzyme inhibitor. Okay. So, now protectants. Sucralfate. Sodium bismuth subcitrate. Okay, so nothing to tell about much about this protectants. These are the ulcer protectants. So I have written bracket in ulcer. The ulcer protectants because they are sucralfate and sodium bismuth subcitrate, which will protect HCl encounter into the stomach. That's all. But nothing much about, and nothing pharmacology is also nothing more in that one. They are the colloidal substances. Only one thing is that colloidal substances. So usually elderly means the people who are elderly used to tell that whenever we have taken something, whenever it is undigested, always they will drink one caustic soda, or from soda they will take beverages. Why they will take? This very simple technique is that one. For the digestion of food, we require HCl. How the HCl is coming? When we are taking carbon dioxide in caustic soda, what is there? It is carbon dioxide. That is why it turns milky to lime. So that is another concept. So carbon dioxide is more in the soda which we will take. For whenever this carbon dioxide enters, it will react with water and it produces hydrocarbonic acid. This hydrocarbonic acid will produce H+ ions. From systemic circulation, Cl also will come and joins. So H+ Cl gives rise to HCl, which will be useful for the digestion. That is why always the elderly ones will say that whenever there is indigestion problem, take carbon dioxide. Okay, nothing but the soda. So why I am telling all this thing is that this will not work if we take ulcer protectants like sucralfate. So sucralfate, sodium bismuth substrate, if we take, there is indigestion problem. If you drink carbon dioxide, what will happen means the carbon dioxide will not reach and produce HCl, and by the way, the systemic circulation carbon dioxide will be increases and there will be base level increases in the systemic circulation. That will lead to another problem. Okay, that is why we should be very careful that we should not take the sucralfate or sodium bismuth substrate. That is nothing but a ulcer protectant whenever there is an ulcer. That is most important thing. Third, about antacids I have told. And one more thing I want to tell is that this antacids the thing is that the antacids we should not take with fluoroquinolines. Why the fluoroquinolines come here? I tell that Helicobacter pylori, means H. pylori, Helicobacter pylori. So Helicobacter pylori. These pylori can be treated with fluoroquinolines also. Fluoroquinolines are nothing but the gram-positive bacteria. This gram-positive bacteria can be treated with the fluoroquinolones. So, if you have ulcer, okay, and if you are taking fluoroquinolones, okay, for ulcer you can also use what? Antacids. So, never ever use these fluoroquinolones with antacids. What is my point is that you have ulcer with H. pylori. So you are taking fluoroquinolones. Okay? By mistake, you gone into another doctor or another pharmacy and they have given antacids. Why? Because antacids can also be used in ulcers. So fluoroquinolones, if you are used with antacids, anti-acids, it will form complex. So I am very much stick to my point is that we never ever should not combine this fluoroquinolones with antacids because they form complex and that will lead to another problem, and that disease is that increasing of acid levels inside the human body. That is another concept. Okay, leave that concept and now stick into the ulcer. I told 2 points about the pharmacology is that whenever we are giving the drug, it may not be useful to you, but it should not produce the side effect. So the side effect is the most important thing that we should keep in mind before delivering of the drug. That is why I am telling that the patient who has encountered with an ulcer, never give fluoroquinolones with the antacids. Though that is why my concept is always, I am very clear that when I am telling the drug, the useful effect thing, I just forget about that one. What is the another things we should always keep in remember that cimetidine. It produces anti-androgenic effect. That's why for androgenic effect you should not give. Enzyme inhibitor. So another drug what we are using, we should always keep in mind before giving cimetidine. Famotidine. I said it's a potent drug. That is why we should careful. So another drugs what I have told, antacids like magnesium hydroxide. At what patient we should give the magnesium? At what patient we should give sodium hydroxide? I told clearly. And I told that antibiotics, fluoroquinolones we should not give because antacids produce. So whenever I am telling the things, I should be very precise that what we should give, with what should not give, and what are the side effects. That are 2 things emphasis in my lecture. Third, prostaglandins. Coming to prostaglandins. Okay, a proton pump inhibitors also is there. Proton pump inhibitor at 7th point I will tell, and anticholinergics also there at 8th point I will tell. Because these are the 2 things which you know very thing. But in my lecture I will tell in different manner. So now where we are given prostaglandins. Who are these prostaglandins? For example, someone has came and slapped me. Okay, the slapped pain, in order to reach my brain, so in order to feel pain, I should require the prostaglandins. Okay, so prostaglandins increases. Mucus production is also increases. Who are this mucus? Mucus is nothing but when we have a positive response, that is nothing but cough, the thing is produced known as a mucus. So when we have a cold, the thing slimy layer is known as mucus. So mucus if increases, ulcer protection is also increases. So clearly I am telling that prostaglandins are nothing but agents which are responsible for increasing of mucus inside the body, which will be very helpful for ulcer. That is why I write plus ulcer, means it will be protection for ulcer. So prostaglandins are the agents which will decrease the HCl production. So prostaglandins are very much helpful for ulcer patients. So prostaglandins we can't take directly because prostaglandins are the chemical mediators. That chemical mediators, when we take it will be destroyed inside the human body. That is why what we will do means prostaglandin analog, means which will behave same like prostaglandin, we will take. Example is that misoprostol. So again I am sticking to my concept is that misoprostol should not give for a pregnant woman. So my intention is very clear that whenever I am telling something drug, I always tell the useful effects. Of course, you know it's used as an ulcer, and I will tell the side effects of that one, for which patient we should give, and where we should be very careful when delivering the drug. Okay, so that is the thing. So misoprostol is the drug we should not give for patients of pregnant women. That is why the misoprostol comes under FDA category X, Food and Drug Administration X. Okay, Food and Drug Administration, that's another story. Food and Drug Administration is comes from United States of India, and it comes under 4 categories for pregnant women, that is A, B, C and D. Sorry, not D, X. Okay, X is nothing but the pregnant woman should not take, means that comes under FDA category X. FDA category A means which we can take. FDA category B means the studies which will not have, means the studies we don't predicted or done, but some parts or few at major cases we can take. FDA C category means if the other alternative is not available, means at that time only we should take for a pregnant woman. FDA category X means that will cause a serious effect for the pregnant woman. So now we are talking about the pregnant effects. So pregnant women for misoprostol we should not give, because the misoprostol produces uterine constriction. So uterus, if it was constricted, it will lead to premature labor. Okay, without maturing only we will start the labor. So at that time, so misoprostol we should not give for pregnant women, because it produces a uterine constriction effect. Okay, that comes under FDA category. That's most important thing. Okay, so about antacids, so it's nothing but prostaglandin. Next we will talk about antibiotics. Before going to antibiotics, let me finish this 7 and 8 concept also. Then but the PPIs, everyone knows PPS, proton pump inhibitors. Example: pantoprazole, rabeprazole, lansoprazole. So what is this pantoprazole? For pantoprazole, I will tell a beautiful concept that in a medical shop, whenever you have gone for an NSAID, something pain I have, give me one tablet. The pharmacist will give one drug. Okay, painkillers are nothing but NSAIDs usually. Whenever NSAID they will give, the cost of the tablet is 2 rupees only. But along with NSAID, they will give another drugs known as a proton pump inhibitors like pantoprazole, which costs 6 rupees. Actually, this pantoprazole one for pain, there is nothing relation. But for NSAID, not to cause harm, only we will give pantoprazole, which is 6 rupees tablet, and that is 2 rupees tablet only. So why I am telling about this one is pantoprazole. Example: proton pump inhibitors. Example: pantoprazole, rabeprazole, lansoprazole. I will write on the board. Now I will want to write about pantoprazole drug. Panto, under the brand name, it will produce products by Reddy's company. That's another drug. Pantoprazole. What it will do? Pantoprazole will increases the naproxen absorption. Most important thing. Naproxen absorption will be increased when we have gone through pantoprazole. So pantoprazole, when we have given, this naproxen absorption will be increases. So naproxen if increases means pain will be healed so quickly. As the drug is absorbed more into the body, it can show the most therapeutic effect. So pantoprazole, so naproxen increases with the pantoprazole drug. And where all this thing is proton pump inhibitors. So this is the pump. So HCl not to produce H plus ions to reach the Cl ions. So this proton pump should be stopped. So if the proton pump is stopped, means HCl is not combined with Cl. So HCl is decreasing. As the HCl is decreasing, we are reaches to the target that ulcer protection is more. So this is all the things about pantoprazole, rabeprazole, lansoprazole. So some are the drugs which produce proton pump inhibitors. And 8th point is that another drugs which can decreases the anti-secretion, means which can decrease the secretion, is that anticholinergics. So I am not writing much about this one, because anticholinergics, broadly think, can I write here so that you can understand? Anticholinergics. Okay, cholinergic is the thing that it produce more secretion, more sweat. more prolactin level for a pregnant woman to give to the baby. More prolactin means breast milk, more digestive enzymes will increase. So all that are the effects of a cholinergic. How means I will tell in later class. That is beautiful concepts, cholinergics and anticholinergics, we will tell later. So anticholinergics are the agents which can reduce the acid secretion. So anticholinergics we will use like atropine, belladonna. So there are huge number of anticholinergics, there will be under subclass class. So anticholinergics can also be used in this concept. So this is all about the ulcer only. Okay, so that's we will conclude for this one, because it is so much heavy for this one. After we will go for another disease. Thank you so much.